So many women in my childbirth prep classes that are planning on breastfeeding ask, what happens when my baby cuts teeth? What will happen to my nipples? And yeah, that's a good question. And some biting might happen. And yes, I'm gonna be real, it hurts really, really bad. And I was bit, there's like about a period of a month with my son where I was frequently bit, and I'll get to why. And with my daughter now, she still does the occasional bite at around 11 months. And while it might seem like our babies are just doing it to be cruel, they are not. There are reasons for the biting. So one potential reason is that the biting is a reflex. So just like babies have the reflex to reach around for the breast, to suck, to swallow, to gag if they feel like they're kind of choking. Sometimes they have the reflex to bite. When they are teething and they just want to chew on stuff, that can result in biting. If their brain is just curious about cause and effect, they bite down to see what happens. And if they have a cold or an ear infection, if they have like a hard time swallowing, if they have a stuffy nose, pain in the ear, they might be more inclined to bite down when nursing. The good news with this is that they'll likely stop biting when the cold, the stuffy nose, when that goes away. And in the meantime, what you can do for that is get them in a seated position when they're nursing and use a humidifier as often as possible. And if they're tugging on their ear a lot, they could be biting because of an ear infection. So it's best to let the pediatrician know. Okay, so other things you can do just in general for biting, you want to be really vigilant about the position that the baby is nursing in. So they're less likely to bite when their head is angled back and their tummy is pressed against your upper abdomen and they have a really deep latch. Because when this happens, they're actively nursing and usually their tongue is covering their bottom teeth and or their gums, and they can't bite you. Start to look out for pre-biting signs. So notice if there's certain things that your baby does right before they bite, and if you notice them starting to do those things, take them off the breast before they can bite you. So for example, my son would always start to bite when he was like getting drowsy, and it was kind of this reflex that he had as he was falling asleep. So I would try to take him off the breast when I noticed that he was starting to get drowsy. I've also heard of babies biting when they kind of get distracted, and as they turn the head, they kind of chomp down and take the nipple with them. Ow, my daughter's done that. And then obviously if you notice them pull their tongue back, take the breast out fast. You want to make sure they're on a loaded breast. So as I just mentioned, if they're actively nursing, they're not going to bite you. So if you can tell that they're actively getting milk, it's unlikely that they're going to bite. But if you notice that they're not like, you're not hearing them swallowing and you think, okay, maybe they're just kind of like sucking for comfort now, you can take them off the breast to, again, reduce the chance of the biting, or switch them to the other side. Switch them to the other side when you think that that breast is empty, or if you think that they're just not hungry anymore, but they're just still kind of like messing around with the nipple, you can end the nursing session. If they do bite, make sure you unlatch them by sticking your finger in their mouth. The instinct is to just like rip them away from the breast, but if you do that, you can damage the nipple even more. So even though like every second feels like agony, instead of yanking them off the breast, just stick your finger in there to break the latch. You can also stop nursing temporarily. So, you know, if they do bite down, you can take them off the breast and just let them know, okay, like that's not a plan. We're not going to nurse if you do that. And I'm not talking about like not nursing for days, but like 15 minutes or so. So each time they bite, they get the message that they don't just get to keep immediately nursing. You can also give them something else to chew on if you think that they're biting because of teething. So if you notice them bite, take them off the nipple and then give them something else to chew on. And if you have a really loud reaction, I've talked to plenty of moms who feel so guilty because their baby bites and they just like scream and then they scare the baby and the baby starts crying. That happens. Do not get down on yourself. It is absolutely normal to cry out in agony when somebody bites our nipples. So if that happens, reduce your guilt by just like apologizing to your baby. Say, oh wow, I am so sorry I scared you, but you bit me and that really hurt. So that's why I did that. All right, so those are my main tips. If you're currently being bit, I'm so sorry. I am currently in the same boat with you and it is tricky. Every time you nurse, it makes you pretty nervous. But it has been my experience that typically it's just a phase. It doesn't last throughout all of breastfeeding. But if you have any questions about this, anything else about pregnancy, childbirth, early motherhood, let me know in the comments below.